clocking out, you're done, you're going home. As an NP,
So this girl was talking about the difference between bedside nursing and then being a nurse practitioner. So she was talking about the difference from when she was a bedside nurse. She said it was the hardest thing she had done. And then when she became a nurse practitioner, she said that the biggest difference was that she was now responsible for patients like 24/7, round the clock. And then the point that she was making was that when she was a nurse, she worked shift work. So 12 hours, 10 hours, 8 hours. And then when she went home, she was home. That was it. She even made the little clicking sound. It was done. It was closed. She transferred care to the next nurse. And then when she became a nurse practitioner, she said that she can't stop thinking about her patients. She's getting emails. She's dreading emails all day, all night. She can be answering emails. The work never stops. Whew. And just saying all of that just stresses me out. And the reason it stresses me out is because I experienced the same thing as a new PA, new physician assistant, which is pretty damn similar to nurse practitioner as far as the jobs that we get to do. But I only experienced this when I was in primary care. So when you're in primary care or any role similar to primary care where you have your load of patients, your 200, 500, 1,000, 2,000 patients, however many you're responsible for, those are your patients. Anything that happens to them, any consults, any specialist visits, any medications, any medication changes, any emails, anything the patient wants to reach out to you about, all of those people, 1,000 plus if you're working full time, all those people, you're their person. You're their provider. And so that does get overwhelming. That does get stressful, especially because it waxes and wanes, right? If all of your people are healthy and they're not going to the ER and they're fine, you're chilling. You might see them for their 3-month, 6-month, 1-year visit, and that's it. But if anything tends to happen, if they go to the ER, if they have a specialist visit, if they need a medication change, if they're going on vacation, they want their antibiotics, X, Y, and Z, you're their person. And sometimes those things really reach a tipping point where dozens or hundreds of people want something at the same time, and you're sitting there in front of your computer looking at your inbox just beating your head against the freaking table because you just want to die. I'm being dramatic. You don't want to die. But anyway, so that was my life in primary care, and that's also why I got the F out of primary care pretty damn quickly. Now, primary care is super important. We need more primary care providers, but that's just kind of the reality of primary care, where people just have all that access to you and you have a tremendous amount of responsibility for all of the the documents that are being dumped onto your desk, into your virtual desk, into your laptop, and you're responsible for all of it. And then if you happen to, this is the scary part, if you happen to miss a critical lab because you have thousands of other ones to go through, you're effed because your patient's effed. So it's fucking terrifying. Oh, I'm going to erase the F word. It's freaking terrifying, guys. It's really, really terrifying. And perfect example. So when I was in primary care, I saw somebody who had come in for belly pain or something like that. And then, I couldn't really find anything wrong. And then she came back saying that it had gotten worse. And now she's got weird bruising all over her belly. And then that triggered me and also my supervising physician to be like, wait a minute. We need a stat CBC. Something's going on with this lady. And then sure enough, her platelet count was 20,000, which is extremely bad. And so I told her to go to the ER. I think I may have even told her to go to the ER because I was concerned about it anyway, but I was still waiting on the stat labs. And then sure enough, 11 p.m., I'm in bed. I have no business having my phone even on. I'm in bed. I get this phone call from a number I don't recognize, so I send it to voicemail. And then something in the back of my head, something makes me worried and then makes me think about that lady and goes, maybe you should answer this message. And I answered the message and she's freaking out. It's that lady calling me. I don't know how she got my personal cell phone number, but she somehow got it. And so she's calling me at 11 o'clock while I'm at home, should be asleep or almost asleep. And she's like, look, I'm at the ER. They're telling me to go home. You told me I need to go to the ER. I'm scared. And so I'm like, wait a minute. They're telling you to go home? Are they nuts? Put whoever is in the ER on the phone with me right now, whether it's the triage nurse or the provider or whomever. And so I think it was the triage nurse or someone, or it might have been the provider, gets on the phone with me. And I'm like, listen, you are not going to let this lady go home. Her platelet count is 20,000. You need to, do a stat CBC, see if it's gotten worse. She probably needs platelets. She probably needs high-dose steroids. I don't know exactly what kind of autoimmune process is attacking your platelets, but this is not normal, especially for her. And they're like, okay, roger that. She wasn't explaining it well. She didn't really understand what was going on. But now I get it. We're going to work her up. And then, of course, I was relieved because, the torch had been passed, at least for that minute. But if something would have happened, one, it's terrible for her because she could have died. She could have had something debilitating happen. You know, she had a really, really bad autoimmune, like short-term condition. I don't know what caused it, but it was really bad. It was life-threatening. That's why I sent her. But if I would have not answered that phone call, she could have been in trouble and or dead. If I would have missed the stat lab before leaving for work when it finally came in at 4:45, even though I usually get up at 4, you know, if I hadn't looked at that stat lab and told her, hey, this came back and it was bad, you need to go to the ER, same thing. She could have overnight decompensated really badly. Her platelets could have gone even lower. She could have been dead. And what am I trying to say with this big, like long, drawn out story? Is you're responsible for that kind of situation times however many patients you have. Dozens, hundreds, probably a couple thousand. A normal patient load for a primary care provider working full time is 1,000 to 2,000. Some people have even more. So all of those people could have something like that happen that you are now responsible for handling, working hours or not. It doesn't matter if working hours are 4 or 8 to 4. If the stat lab comes in at like 11, now usually practices will have some sort of a mechanism, like there's a nurse on call and any like critical lab she'll send to you and call you no matter what hours it is, or whoever's on call at the practice or whatever, you know, and they'll take care of it. So there's mechanisms in place for this. But the point is, when you're in primary care, every single thing that happens to every single one of your patients at all times is your responsibility. Okay, so I'm not trying to discourage you from working primary care. It's very, very important, but do understand that that is your responsibility when you are someone's primary care provider or someone who has regular follow-up with someone. So you're their mental health provider, you're their psychiatric nurse practitioner or psychiatric physician assistant or physician, you're their gynecologist or gynecology physician assistant, internal medicine, whomever. Like if you're their regular, or even a specialist, honestly, even if you're like their gastroenterology physician or physician assistant or nurse practitioner, you're responsible for anything that happens to them, at least with regard to your specialty. And if you're in primary care, then you're responsible for everything. So again, I'm not trying to dissuade you from going into primary care, but understand that is the responsibility. And that's also why a lot of people are not going into that specialty. Now, to disagree with the girl that I stitched, she said that that's her responsibility now that she became a nurse practitioner rather than a nurse. Well, that's not every nurse practitioner. That's not every physician assistant, and not even every physician. That's everyone in a role that's like primary care or similar. If you're, for instance, in emergency medicine, in urgent care medicine, maybe even surgery to some extent, you're not like that at all. You're seeing the patient that day, and that's it. It's your shift. Once your shift is over, it's over. Like, yeah, the patient might come back tomorrow. Yeah, they might send a message, and you might need to reply to it next time you're at work. Lab results might come in that you ordered or that somebody else ordered, one of your colleagues, and you have to do something with those. Yes, but that's while you're at work. When you're not at work, there is no responsibility. There is nothing that you need to do. There is nothing responsible for. The urgent care or the ER operates, around the clock or at least every day. And whoever's there, they're responsible for what's going on, whether it be whoever's there right now, whoever, was seen yesterday and has a question or has something going on or has results that come in and you have to treat something. That's while you're at work. But once you're off work, you're off work. It's just like the shift work thing that she had mentioned when she was a nurse. When you're going home, you're going home. That's it. Nobody can call you about anything. In rare circumstances, someone might be like, hey, what did you mean by this? Why did you do this? And then you can answer that. But generally, no. Once you're off work, you're off work. So as a nurse practitioner, as a physician assistant, even as a physician, there are jobs and there are practices and there are specialties that you can still have that sort of life where you just leave work at work. But in some of those kind of more primary care roles, that is your responsibility. You're constantly on the clock, always doing stuff, always worrying about your patients because at any time, anything could happen to them and you're their person. So, choose wisely.